Hello, everyone, and welcome. Thank you so much for joining us today for Real Voices, Real Insights, a discussion on Palsonify. We're so glad that you can be here. Before we get started, I'd like to review a few housekeeping items to help the program run smoothly tonight. You are welcome to submit questions throughout the program within the Q&A section of Zoom. From there, we'll do our best to address as many questions as possible during the Q&A portion, which will be at the end of the webinar. Please note that the presenters are unable to provide medical advice, so be sure to follow up with your healthcare provider with any questions related to your personal health or treatment. With that, it is my pleasure to introduce our first speaker, Dr. Brett.
Hi, thank you so much. So we are here today to talk about Palsonify. Palsonify is an oral medication to treat acromegaly in adults in whom surgery was not effective or whom surgery is not an option. Palsonify can increase your chance of getting gallstones, high or low blood sugar, and low heart rate. It's important to let your doctor know your full medical history before starting the medication. It's also important to let your doctor know if you are pregnant, nursing, or planning to become pregnant in the near future. It is not known if Palsonify will harm an unborn baby or if it passes into breast milk. Certain medications can affect the way Palsonify works, and Palsonify can affect the way other medications work. It's important to let your doctor know everything you are taking, including over-the-counter dietary supplements. One very common medication that can decrease the effectiveness of Palsonify is proton pump inhibitors, which are types of acid blockers. Also, the herb St. John's wort and certain anti-seizure medications can also make Palsonify less effective. Palsonify, like all medications, can have side effects. If you take the medication, you need to let your doctor know if you have pain in your belly or yellowing of the eyes, as this can be a sign of a gallbladder problem. Palsonify can also cause you to lose fat in the stool and to lose weight. If you take Palsonify, your doctor will monitor your heart rate and periodically do blood tests to check you for thyroid problems and low vitamin B12. The most common side effects of Palsonify include diarrhea, pain in your belly, nausea, vomiting, decreased appetite, slow heart rate, high blood sugar levels, and palpitations. But these are not all the possible side effects of Palsonify, and you are encouraged to report negative side effects to Crinetics Pharmaceuticals. Today, Megan will share her personal journey with acromegaly and her experience with Palsonify. Then I will talk about acromegaly and the importance of treatment. I will talk to you about Palsonify as a treatment for acromegaly, and I will share a resource to support patients prescribed Palsonify by their doctor. And then finally, we will have a question and answer session. Now Megan will share her personal journey with acromegaly and her experience taking Palsonify.
Thank you, Dr. Brett. All right. So, hey, friends, my name is Megan. I am 31 years old. I live in a small town in Arkansas that you've definitely never heard of. And I am here today as a patient, but in my professional life, I practice as a clinical dietitian. I currently work in an outpatient setting. And my favorite part of what I get to do every day is helping patients understand that their diet is one part of their healthcare that they are in charge of. So, I really enjoy the opportunity to encourage them and let them know that I'm always there, sometimes as a pit crew, but most of the time just as a cheerleader. Outside of work, I am also a wife, and a dog mom, as cringy as that term might be. This is my little family. So I have two dogs. There's Sophie there on the left. She is a 15-year-old Yorkie, and she is definitely the princess of the castle at my house. And then we have Virginia in the middle there. She is a schnoodle, and she's about 1 year old. And she just recently came to live with us after she just appeared in the parking lot at my clinic one day. And I brought her home for the night, just so she would have somewhere safe to sleep. And my husband said, so she doesn't have anywhere to go and she doesn't have anybody to love her. Does that mean she just lives here now? And I said, yeah, I guess so. So I feel like that's a really great illustration of the kind of person my husband is. He's just always supportive, always ready to jump into anything that I need. And it's been really important to have his support as well as the support of my family, my friends, my faith, all of those kind of things, because I was diagnosed with acromegaly in 2023 when I was 28 years old. So today I'm really excited to share my diagnosis and treatment journey with you. It is important to note that I am being compensated by Crinetics to share my personal experience with Palsonify, and yours may be different, but my hope is that if I share my story, that you'll see you're not alone in your acromegaly journey, and you'll feel encouraged to advocate for yourself as you move forward. So I started noticing acromegaly symptoms early in college. So I had a really active childhood. I played a ton of sports, pretty much any kind of activity I could get into. I was there. I specifically played things like basketball, volleyball, soccer. I cheered for a little while. And early in college, I really started to feel some pain in my joints, specifically my knees, my ankles, ribs, hands, and feet. And with all that said, I kind of come from a background where it's normal to, if you mention something and it's not really well received in terms of, having aches and pains or things like that, you just kind of rub a little dirt on it and move on. So I just kind of kept going with a positive attitude. And over the next few years, I actually started running a lot once I got out of organized sports as a teenager. And I even ran my first marathon. And around the same time, early in college, I started to notice that my face was kind of changing shape. It felt like my forehead was getting longer and my features were becoming more defined. And my face just didn't really look as soft as it used to. And I've never really been a person that had a ton of self-confidence. So I would come home on the weekend from school and I would say things to my family about the way my face looked. And they would offer reassurance and say things like, well, you're getting older. You're not a teenager anymore. You're growing into your adult face. Your features aren't going to be as soft as they've always been. It's not a bad face. It's just a little bit different. And sometimes people have a little bit more, fluctuation as they kind of grow into what they're going to look like fully in adulthood. So those were, normal explanations for what was happening, but it didn't really fit what I was seeing. And then I started to have some more symptoms emerge. So um, my clothes really started to feel tight. And because I was so active, I spent a lot of time wearing gym clothes. So I really noticed that anything with like sports bras or things that were really fitted through my midsection would start to feel really tight. And it felt like I couldn't breathe as well. Um, my feet would swell so much that at the end of the day, I felt like I had to sit on the edge of my bed or on a chair and like pry them off of my feet instead of just taking my shoes off like I normally would. Um, I had some ankle injuries that were pre-existing from sports when I was in high school, and they progressed really quickly at that point. And I ended up having surgery a couple of times early in college, and that kind of prevented me from wanting to pursue college athletics. So, as time went on, those symptoms just kind of became more severe, and I went from being able to run a marathon to the point that my knees hurt so badly that a lot of times I couldn't even bear weight on them. So, if I sat down on the floor or squatted down too deeply, I couldn't stand back up unless I had something to put my hands down on. Or if I was all the way on the floor, I would press out into like a plank type position and then walk my hands back to my feet, just like hinged at my hips and stand up that way. I also started to get really severe headaches and I started gaining a lot of weight, like several pounds per week, no matter what I ate or how much I didn't eat or how much I continued to go to the gym. So I talked to my general practitioner at that point about my symptoms, and she diagnosed me with polycystic ovary syndrome and anxiety. And neither of those things felt like they were the whole story to me, but I just didn't really know where to go from there. So I kind of just went with it for a little while. Like, I would say that I was experiencing severe headaches that wouldn't go away. And the explanation would always be something like, well, that's probably just happening because you're not taking your anxiety medication. And since you're not doing that, you're getting kind of worked up. And it's just like a cycle there. You're getting worked up, that's giving you a headache, and then the headache won't go away. So that went on for several years. And at some point, that provider moved to a different clinic. So, on a recommendation from family members, I switched to a different doctor. And by the time I met my doctor, I had really just kind of gotten to the point where I was used to having my symptoms explained away. So when I met him and we kind of established a relationship, and he said, I don't really know what's going on yet, but I believe you. That really changed everything for me. Like for the first time, I didn't feel like I had to rehearse what I was going to say before I went to an appointment just to be taken seriously, or didn't feel like I had to have the right collection of symptoms figured out for myself before I told somebody else about it just to have access to care. So, um, I was really young and I didn't really know yet what it was like to advocate for myself without feeling like I was being disrespectful. But having a doctor that was in my corner was really important at that time because I learned how to advocate for myself, and he never minimized what I was saying or made me feel like I should feel small for speaking up. He just believed me and connected me to the right specialist, and things kind of progressed from there to get the right care. So that experience really taught me that you don't have to have every single answer to change somebody's life. You just have to care enough to listen. And if you have the power to do so, act on it, because that's what eventually led me to an endocrinologist office for the first time. And even that wasn't some big breakthrough moment for me. It would actually still be several months before I really understood anything about what was happening in my body, but it was the first step. So, my endocrinologist initially also attributed most of my symptoms to PCOS and mentioned that I probably had prediabetes as well. We did some more tests during my first visit, we did blood work, and I kind of got a standard come back in 3 months and we'll reevaluate where you're at. So before the follow-up visit, I got a letter in the mail that said my blood work was normal. And then when I came back 3 months later, my endocrinologist reviewed my IGF-1 levels that she had drawn during my first visit, and I guess realized that they had never looked at the results when they came back after that first visit. So I kind of saw this look of shock in her eyes, and she said, "We're going to run several tests. You're going to get an MRI of your brain." And she wrote the word acromegaly on my lab paperwork from that day. And I wasn't really scared or overwhelmed. I'm just kind of naturally inquisitive. So I started asking questions and said, what does that mean? What are we talking about? What should I be expecting? And she was never really one who was much for a lot of questions. She was a little bit direct. So she was quick to say, we're not going to talk about that right now. I don't want you to get anything in your head until we know for sure what's going on. And that was kind of the end of the discussion at that point. So I went to the lab for blood work that day. And when my tests were done, I kind of just walked to my car a little bit in a fog because I didn't know much about anything that was going on. So I did exactly what most medical professionals will tell you not to do. I walked to my car and I sat down in my driver's seat and I Googled what acromegaly was. And for a lot of people, I think it seems like this should be some awful earth-shattering moment for me, but I just felt a lot of hope and kind of validation in that moment, because it was like seeing a list of everything that had been happening to me for years that I had been trying to tell everybody around me, and they just weren't symptoms that went together. So nobody thought it made sense. So it didn't get addressed cohesively like that. And I really thought, oh, so there's an explanation for this. It all goes together. And I was almost excited to recognize that. So I used to be really bad about going to appointments by myself. So I called my husband and I explained my appointment, what I had read online, and again, I just really felt kind of optimistic and relieved about a potential acromegaly diagnosis. So a few weeks later, I went back to my endocrinologist, and I had a growth hormone suppression test, which I failed. And then subsequently, I had an MRI. And I felt really bad for the technician that day because I had my MRI done and she said, "Well, you did such a great job. You sat really still, and I got a bunch of beautiful pictures of your brain, and I'm sure somebody will be calling you in the next few days." Um, and I could tell she was pretty sure something was in there, and I wish I had had the heart to tell her that I knew there was probably something in there too because she seemed really upset about it. So, my doctor's office called within the next couple of days and told me that my MRI did show a tumor in my pituitary gland, and I was officially diagnosed with acromegaly in June of 2023. So this picture on the left was actually taken at the lake while I was on my family camping trip the day I was diagnosed. And then soon after my diagnosis, I saw a neurosurgeon in Little Rock, Arkansas, which is about 2.5 hours north of where I live. And we scheduled my surgery for October. And my symptoms were probably the most severe in the 3 months between my diagnosis and surgery. At work, I would try to see all of my patients in the morning because I would get headaches at a pretty consistent interval every afternoon, and they were bad enough that I didn't want to leave work or take time off, but I would turn the lights off in my office, wear sunglasses, turn the brightness down on my screen just to get through charting from my visits earlier in the day. Um, my hands would get really swollen to the point that I would drop things sometimes, or I wasn't able to make a fist, and I kept gaining weight really rapidly. And so I actually have sets of kind of dupes of my wedding rings in multiple sizes because my husband didn't know what else to do and he was trying to be helpful and make something feel normal. So I have a bunch of different rings. Um, and needless to say, I stopped working out as much as I normally do, which was a huge red flag for anybody who knows me because I'm normally very active and trying to find any kind of adventure that there is. So I also experienced a lot of insomnia, and it wasn't like any other kind of insomnia I've ever had where you feel like you're just an inch away from sleep if you could just get there. It was really aggressive insomnia. So I would get up and clean my house or bake cookies or hang pictures on the wall or anything else I could do just to occupy time because it felt like I was living this whole other life while the rest of the world was asleep. Um, so my initial IGF-1 levels were in the 500s in March of 2023 when I initially had them drawn, which is already pretty far out of range for me, but they continued to climb. And by the time I had surgery, I was in the upper 700s, or I guess the last draw I had prior to everything related to surgery. And then we were climbing closer to 1,000 by the time I actually had surgery. Um, so after my surgery in October of 2023, I was really exhausted and recovery was difficult. And I think in a way it was probably more mentally difficult than I had expected. But I did recover physically pretty quickly. And this picture on the right is of me and my dad the day that I ran my first mile after surgery. And it felt like such an accomplishment and that we were well on our way to, bigger and better things. But while that surgery did help with some of my acromegaly symptoms after surgery, I still experienced weight gain. I still had joint pain and headaches. I still had a lot of swelling. And so I tried several different treatment options. I started with multiple daily injections. From there, I went to a single daily injection. At one point, I was on combination therapy. I was on a monthly injection at one point as well. And with all of these different treatments, I would either gain some symptom control, but I would have side effects that were significant enough that I couldn't continue with the medication, or the side effects would be manageable, but I would maybe gain control for a few weeks and then my symptoms would start to return and I would get breakthrough symptoms. So it never felt like I could just settle in and just live my life. I would get a little bit of relief and then I would feel awful again. So with other treatments, I felt exhausted really often. My headaches were still unbearable. My rings still never fit. And I kind of had this idea that I needed to adapt my lifestyle around the medications just to make them work. And there was a lot of adjusting to, you know, scheduled injections or when I thought I might feel unwell. So at some point, I just kind of made a habit of starting to search through what new things might be available in acromegaly at this point. So I would look in acromegaly groups. I would, do my own searches online. Um, just kind of looking for anything that might be out there. So I heard about Palsonify in little pieces. And when I first found out about it, it didn't have FDA approval yet. So I was really interested in it from the jump. And I would try to check in for updates really often. And one thing that was really appealing to me is that it was a once daily oral treatment. So it was pills. And the regularity of that was really interesting to me because I had been taking these other medications that were given at longer intervals and I would have breakthrough symptoms in between. Um, so another part of advocating for myself was finding a new endocrinologist because as I was exploring treatments, I knew that I wanted somebody on my team who was more open to that collaborative approach, and valued what I had to say about my treatment and my life. So I found a new doctor who is empathetic and collaborative, and she's really open to my questions. So we talked about it together, and she agreed that she thought Palsonify might be a good fit for me. So I started taking it in November of 2025, and fitting it into my routine has worked really well because I just wake up, I take 2 pills on an empty stomach, and then I'm able to shower and get ready for my day. I usually commute to work and get there a little bit early, and then by then, over an hour has passed, and I'm able to eat breakfast. And I don't experience any side effects with Palsonify, but my doctor did explain that there can be some side effects, including diarrhea, stomach pain, or nausea. And we did discuss that before I started taking medication. But since starting it, I've noticed improvements in my residual acromegaly symptoms. So my headaches are less severe, my joints are less painful, the swelling in my hands and feet have gone down enough that I actually wear the smallest set of my wedding rings that I have. And since my symptoms are better managed, especially my joints, I'm able to work out and get in the gym again. My knees hurt less when I squat or I put weight on them. And one thing that really stands out to me is the first time I did blood work after starting Palsonify, I saw some results in the portal that morning. And I had stayed at my parents' house the night before. And I opened the results in the portal and saw that my growth hormone numbers were the lowest that they had ever been since I've known that I had acromegaly, and that my IGF-1 number was 134, which is well in range for me. So without even really thinking about it, I sprinted down the stairs and threw open the door to my parents' bedroom and jumped in the middle of their bed and woke my mom up, like jumping up and down, giddy, like it was Christmas morning. And then after all of that excitement, it really hit me that I wasn't buried in treatment research. I wasn't trying to figure out what I could do better to make my medication work for me the way it was supposed to or the way it was expected to. It was just working, and it had removed a lot of mental burden from managing my own care. So, please remember that this is my personal experience and yours may be a little bit different. Um, but I do think it's important to remember that I still deal with some acromegaly symptoms, but they don't stop me from living my life. So I've been able to make modifications to my routine. I find a lot of activities that work for me. I'm able to enjoy playing with my dogs. I still go running. I participate in like high intensity water sports. I do all kinds of things with my family. They're always down for an adventure. And a few years ago, I found a bungee studio in my community, which is the most fun thing. And essentially, you get to run and jump and fly and do all of these things with the support of bungee cords. So it's fun and it's challenging, but it's also a lower impact workout. So it's easier on my joints, and I'm able to do a lot of things that I wasn't able to do before. I teach group fitness classes. I teach rebounding, which is mini trampoline, and then I teach aerial yoga. And physical fitness is a really big part of my life. So I'm grateful to have a treatment that manages my symptoms so that I can continue to be active. And I think one of the most important things to recognize is that sometimes I'm still surprised when I see my face in the mirror. I just feel like myself. So sometimes it hits me like, oh, yeah, I kind of forgot that I look like this now. But I am really learning to accept the changes in my appearance, and I've gotten to where I'll tell myself this face is good too because it represents me now and everything that I've been through at this point. And in a way, I really like the way my face has changed because so many people with acromegaly share some distinguishing features, and that just seems really poetic to me that I get to share some features with some of the people that I've grown to love the most because it feels like we are kind of one big family. And I've always admired people who go through really hard things but don't let those difficult things define them. People who are joyful and have a positive mindset and just kind of radiate their authentic selves. And I really hope to be one of those people. And now I feel like I can be that. I feel like I'm just Megan and I have acromegaly. It's not a defining part of who I am. So part of keeping a positive mindset for me is focusing on the choices I can make that are within my control. And I'm really, really glad that I continued to advocate for myself until I found a treatment that works for me. And I encourage you to keep advocating for yourself and your needs as well. So thank you for your time. I will pass it back over to Dr. Brett so that we can talk a little bit more about acromegaly and the importance of treatment.
I'm Dr. Elise Brett. I'm a clinical endocrinologist. I'm in private practice in Manhattan. I've been in practice since 1999. I'm a voluntary faculty at the Icahn School of Medicine at Mount Sinai, and these are my disclosures. Today's program is sponsored by Crinetics Pharmaceuticals. I'm being paid by Crinetics to share this information with you today. We will talk about acromegaly in general, but I'm not allowed to answer any medical questions related to your personal health. So be sure to follow up with your own doctor if you have questions about whether PALSONIFY is right for you. So acromegaly is a rare disease. There are only about 36,000 people in the US living with it. And there are about 1,300 new cases a year. It's most commonly caused by a benign tumor on the pituitary gland. So the pituitary is the master gland that sits at the base of the brain. And these tumors make excessive amounts of a hormone called growth hormone, which then acts at the liver to cause excess production of another hormone called IGF-1 that you just heard about. And together, these elevated hormone levels cause lots of physical and metabolic problems that affect many different organ systems. Some of the most common problems that they cause are facial changes, hand swelling, joint pain, colon polyps, diabetes, high blood pressure, and sleep apnea. Acromegaly does not get better without treatment, and it tends to get worse over time. Because the physical changes develop very slowly, and because they are not seen in all people, acromegaly can be difficult to diagnose. On average, people are not diagnosed until about 5 years after symptoms start, and some people not till after 15 years. Women tend to be diagnosed later than men, and many people suffer with symptoms such as fatigue, joint pain, headaches, anxiety, and trouble sleeping for many years before they are diagnosed with acromegaly. Without treatment or with inadequate treatment, acromegaly can shorten lifespan. However, when the disease is controlled, people with acromegaly can have similar lifespans to the general population. The first treatment for acromegaly is usually pituitary surgery to remove the tumor. But some people are not candidates for surgery, and many people are not cured after surgery and need additional treatment, which may include medication or rarely radiation. Measuring IGF-1 levels in the blood is the best indicator of disease activity, and the primary goal of treatment is to keep IGF-1 levels in the normal range. Checking random growth hormone levels is less reliable, but also sometimes used. Other goals of treatment include controlling symptoms, managing any related conditions, and preventing remaining tumor from growing. Every patient with acromegaly is different, and treatment requires a personalized approach. We'll now transition back to the branded section of today's talk. So PALSONIFY is a prescription drug that was approved by the FDA in September 2025 to treat adults with acromegaly in people for whom surgery was not effective or for whom surgery is not an option. What makes PALSONIFY unique is that it's the first once and only oral medication to treat this disease. It's an oral tablet that the body can absorb efficiently, and it produces steady levels in the bloodstream. PALSONIFY works by binding to a certain type of receptor on the pituitary tumor called SST2, and it blocks its secretion of growth hormone. Most of the drugs that work similar to PALSONIFY that have been available until now are taken as monthly injections. Today, I'm going to show you data from 2 studies that were performed using this drug in people with acromegaly. This slide shows results from a study called PATHFINDER-1, which included 58 people with acromegaly who were previously receiving injection therapy, who were then switched to either PALSONIFY or sugar pill for 36 weeks. In total, 83% of people taking PALSONIFY maintained normal IGF-1 levels compared to just 4% of people who got sugar pill. The graph shows the average IGF-1 levels of participants throughout the study. And as you can see, the people on the study drug stayed in the normal range, where the people who got the sugar pill slowly increased above it. Out of 23 people who achieved normal IGF-1 levels at the end of the 36-week study and attended a follow-up visit at week 60, 22 of them, or 96%, had normal IGF-1 levels at week 60. Now, here is data from another study called PATHFINDER-2, which included 111 adults with acromegaly who were either new to medication or restarting treatment after taking a break from another medication. For 24 weeks, half of them received PALSONIFY and half of them received placebo or sugar pill. In total, 56% of people taking PALSONIFY achieved normal IGF-1 compared with only 5% taking placebo. The drug worked quickly, with most reductions occurring within the first 2 to 4 weeks. The graph shows the change from baseline IGF-1 levels over the study. Overall, 93% of people taking PALSONIFY experienced reductions in IGF-1. PALSONIFY also helps to control symptoms. In both of these studies, subjects use a phone app called the Acromegaly Symptom Diary to track the 7 most common symptoms you see listed here. In PATHFINDER-1, patients on PALSONIFY maintained symptom control, whereas symptoms worsened with placebo. And in PATHFINDER-2, symptoms improved in the treatment group and worsened with placebo. The most common side effects of PALSONIFY were gastrointestinal, as expected. They were mild to moderate in severity and typically resolved within the first 2 months without the need to discontinue the medication. In PATHFINDER-1, more than 90% of people chose to continue PALSONIFY rather than go back to injections, and almost everyone stayed on track with their treatment. The medication is supplied as a 20 milligram or 30 milligram tablet. The starting dose is 40 milligrams taken as 2 20 milligram tablets per day, which can then be increased to 60 milligrams after 2 to 4 weeks if IGF-1 levels are still elevated, or it can be reduced back to 20 milligrams if you are having side effects. PALSONIFY is an oral tablet that is efficiently absorbed in the intestine. Once daily dosing provides steady levels over 24 hours, and the medication should be taken on an empty stomach for best absorption. Take PALSONIFY with water after not eating for at least 6 hours. So for most people, that's usually first thing after getting up in the morning. Wait at least 1 hour before eating or drinking anything else. The medication is best taken at the same time every day to keep levels steady. So in summary, PALSONIFY is a once daily medication used to treat adults with acromegaly for whom surgery was not effective or surgery is not an option. In clinical trials, PALSONIFY helped to lower or maintain IGF-1 levels. For those new to treatment or restarting treatment after a break from another treatment, PALSONIFY helped to reduce IGF-1 levels quickly in 2 to 4 weeks. PALSONIFY also helped to reduce the severity of acromegaly symptoms. Common side effects include diarrhea, stomach pain or discomfort, nausea, vomiting, loss of appetite, fluttering heartbeat, slow heart rate, and high blood sugar. And at the end of a 36-week clinical study, people switching from injections, more than 90% of those people chose to take PALSONIFY instead of going back to injections. The Crinetics company offers a program called CrinetiCare that can help you navigate access for PALSONIFY, as well as help those who qualify find financial support and provide answers to common questions. CrinetiCare programs are only available if your doctor prescribes you PALSONIFY, and you can scan the QR code or visit crineticare.com to enroll in this program. Thank you. This concludes my part of the talk, and I will hand it back over.
Thank you so much, Dr. Brett and Megan, for both sharing your experience with PALSONIFY. I would love to go ahead and get started with the Q&A section of tonight's webinar. I already see a few questions who have popped in, so let me go ahead and get started with those. First one being, I think I'm well controlled, but how do I know if my acromegaly is really under control or if it could be better? And I think that's a question that could be answered by both Dr. Brett and Megan. Dr. Brett, if you want to go first answering that, that would be perfect.
Sure. The first step is to make sure that IGF-1 levels are in range, but that's not the only way to know if you're controlled. So some people will still have symptoms even when the IGF-1 is in range, and symptoms need to be addressed as well. And so to, related conditions or what we call comorbidities, such as blood pressure and diabetes. And lastly, like I mentioned previously, we also need to make sure that any leftover tumor, if there is leftover tumor, we need to make sure the tumor isn't growing.
Megan, do you want to share your piece?
Yeah, just kind of to echo what Dr. Brett said, getting your IGF-1 level in the normal range is one piece, but it's definitely not the only part of treating acromegaly. So listening to your body is really important, and understanding that if you're still dealing with symptoms, especially if they're significant enough to impact your day-to-day life, there might be something else you can do to help control acromegaly, and addressing it properly means managing both IGF-1 and your symptoms.
All right. And the next few questions I got in the chat are for you, Megan. So first one being, what's it like to take PALSONIFY daily? Did you have to change your routine?
Yeah, so I didn't really have to make any changes to my routine. I'm not somebody who normally eats breakfast the moment I get up anyway, so it fits into my schedule really easily. I just get up, I take my medication, get ready for the day, take a shower, commute to work, usually get there a little bit early, and then I'll eat breakfast in my office because over an hour has passed at that point. And it's really easy to continue to take the medication because I want my IGF-1 levels to stay stable.
Next question we have is there anything you asked your doctor that made you feel comfortable switching to PALSONIFY?
Yeah, so we talked about how this treatment compares to some of the other ones that I've been on, or the one that I was on at the time, what to expect day to day, and whether it might be a good fit for my treatment goals, plus my lifestyle and my routine, and talking that through, and taking all those things into consideration helped me feel more informed and confident about the decision to take PALSONIFY.
All right. One more. I am newly diagnosed. Do you have any advice?
So I can't give you any specific advice, but I can give you some tips for things that worked for me. It's really important for me to feel like I'm being proactive with my healthcare. So I like to write down questions and concerns as they arise. Sometimes I'll take that list of questions with me to my doctor. Honestly, sometimes I'll make my list ahead of time and even like familiarize myself with how I want to ask those questions, or kind of some variations, just to make sure that I'm in a comfortable place to discuss those things once I get there. Um, but I think it's important as much as possible to educate yourself, rely on your professional and your healthcare team. But, you know, put yourself in a position where you understand the information that you're being given. And don't be afraid to advocate for yourself, especially once you have the right people on your team. They're going to want you to do that. They're not going to push back against it. So when I was diagnosed, one thing that I really wish I had understood was that it was happening to me, and I do have the right to deal with my diagnosis however I want to. But the people who love me are also dealing with something that's really unexpected, and they're experiencing something new, and it is a type of grief for them to watch somebody they love go through something difficult. So I'm a really positive person by nature, and through diagnosis and getting started with treatment, I was really resistant to letting my family support me at times. So I would go to all of my appointments alone. I would try to kind of shield them from things that I thought might be uncomfortable for them, or, make them dwell on some of the things that would be happening. And I really wish I had the perspective that my support system is made of people who love me and they're in it with me, and they might need some space to deal with the diagnosis the way they need to, because you can't anticipate how somebody else feels about something, even if you know them better than anyone else.
Those are some great tips. Thanks, Megan. All right. Another question, Dr. Brett, who qualifies to take Palsonify?
PALSONIFY is a prescription medicine used to treat adults with acromegaly for whom surgery was not effective or surgery is not an option. Your doctor might decide to prescribe PALSONIFY based on your specific tumor type, or might choose PALSONIFY over other options based on your specific tumor type or your other medical problems. They might consider your response to prior medications, as well as considering your lifestyle and take into account your own preferences.
Amazing. Thank you. And I have a few more questions in the chat. Feel free to put some more in the Q&A, all of the attendees, and we can get to those. Megan, next question for you. How has Palsonify impacted your acromegaly symptoms?
Yeah. So since I've started Palsonify, when I do have headaches, they are less severe. My joints are less painful. The swelling in my hands and feet has gone down a lot. Like I said, I wear the smallest set of my wedding rings now. And since my symptoms are better managed, especially my joints, which is one of the most problematic things for me, I'm in the gym again, and I'm able to do a lot of physically active things that had become a little bit limiting for me. So especially like my knees and ankles and things like that hurt a lot less when I squat or put weight on them. And the first time I had blood work done, after starting Palsonify, my IGF-1 level was the lowest it had ever been at that point. It was 134. And I've actually had another round of labs since then, and I'm sitting at 119 right now, which is toward the lower end of the normal range for my age. So, which is really great. But I do think it's also important to remember that this is my experience and yours might be a little bit different than mine.
That's amazing to hear. Thanks, Megan. One more question for you. How long did it take for you to see results from Palsonify?
Yeah. So I started to see some results within the first few weeks after I started Palsonify. At that time, the swelling in my hands and feet had gone down. I had already kind of switched out some of my jewelry. Um, yeah, I would say within the first few weeks, but that experience can be a little bit different for everybody as well.
Amazing. Thank you. All right. One more question is all we will have time for this evening, but last one goes to you, Megan. Have you had any side effects from Palsonify? And if so, how long did they last and how did you manage them?
So I have not had any side effects since I started taking Palsonify, but there are side effects that are known to be associated with it. So my doctor reviewed all of that with me before I started treatment, and she emphasized that there might be things like diarrhea, stomach pain, or nausea. And if you have specific questions about that, you can refer to your doctor, or that may be a question for Dr. Brett to go over more of those side effects in detail. But for me, I didn't have side effects, but that is my experience, and it might be a little bit different for everybody.
Thank you so much. All right. And that is the final question we have time for tonight. As we conclude, a survey will appear in your browser window. We would greatly appreciate your feedback on today's program. We'll also include a survey link in the follow-up email if you'd prefer to access it via email. But thank you so much for joining us and have a great rest of your evening. And thank you again, Megan and Dr. Brett.